Okay, so my project that I did this semester was on binge eating in college students. So this is like an important topic to me because I feel like it's something that gets lack or has lack of discussion about it, especially in college students. Because most of the time when we discuss eating disorders, we often talk about anorexia and bulimia, when in reality, binge eating is one of the most common and one of the most unspoken about as well. So I think it's very important that we talk about it. Okay. All right. So what is binge eating? Um, so in a journal by Spitzer, they describe binge eating as eating disturbance of a large number of individuals who suffer from recurrent binge eatings, but who do not regularly engage in the compensatory behaviors to avoid weight gain seen in bulimia nervosa. So the big difference is that there is no purging in binge eating, so there is no throwing up all of the food that was eaten. So it is just excessive eating. Okay, so binge eating. So three, according to Fairburn and Wilson in their book Binge Eating: Nature, Assessment, and Treatment, they describe binge eating as needing three or more of the following: eating much more rapidly than normal, eating until uncomfortably full, eating large amounts of food when not hungry, eating alone because of being embarrassed about how much one is eating, and feeling disgusted with oneself, depressed, or very guilty after overeating. So typically with binge eating, it is diagnosed when you have three or more of these symptoms. Um, and these are just kind of the most common ones. Okay, so according to our book, Introduction to Sociology by Giddens, Dunier, Applebaum, and Carr, they said that 95% of college women want to lose weight, with about 85% of those suffering from serious problems with eating disorders in college. I think it's also important to mention that while we specifically do talk about eating disorders, most commonly in women, they can affect men as well. So according to our book, about 50% of college males also want to lose weight. A lot of the information in this PowerPoint does pertain more towards women, but typically I do think that there's less studies done on men and males, and so I think it's important that we also recognize that as well. So with binge eating among college students, in a survey done by the Contributions to Weight Problem Perception, BMI, Gender, Mood, and Smoking Status to Binge Eating Among College Students, in the Eating Behaviors Journal, they did a survey among college students assessing demographics, depression, anxiety, body image, cigarette smoking, and weight history. So according to their study, about 42.6% of overweight participants who believe they were overweight did admit to binge eating. About 30.1% of overweight participants who did not feel overweight did admit or also admitted to binge eating, while 43.2% of non-overweight participants who believed they were overweight admitted to binge eating, while 32.9% of non-overweight participants who did not feel overweight also admitted to binge eating. I think these are some really important statistics to look at, because oftentimes when we look at binge eating, we often correlate it with obesity and overweight individuals, whereas with these statistics, it is pretty even across the board with overweight individuals and non-overweight individuals. So it is like an important issue within both demographics. It's not really heavily one or the other, which I feel most commonly it's more associated with overweight. So is binge eating a social problem? Yes. So if almost half of all college students have a health issue, like we saw in the statistics on previous slides, it is a health crisis in the college setting. Um, I personally think that it is a huge health issue, just because there is a huge amount of students dealing with it, and it is not being very much talked about. Whereas if it was like, another issue such as like STIs or something like that, it would be talked about if the percentages were that high. Um, so in um, sorry, in the effects of stress on coping and binge eating in female college students, um, they said that most commonly use binge eating as a coping mechanism for stress. So this is emotion focused and avoidant coping were positively associated with stress and binge eating. Emotion focused coping partially mediated the relationship between stress and binge eating. And then no association was found between stress, rational or detached coping, and binge eating. So we do see binge eating as an emotion-based coping mechanism in women, and this study was done on female college students. So my theory is that binge eating is higher among college students, especially women, due to the lack of coping skills. I again, going back to the male also being diagnosed with eating disorders, I do think that it is more based on statistics, it is more common in women. So my theory is based on women. So what causes binge eating? Um, a study done in 2006 from the journal What's Driving the Binge and Binge Eating Disorder, a prospective examination of precursors and consequences from the International Journal of Eating Disorders, says in a study done, they tested 33 females with binge eating disorders and had them track their current emotions, hunger, and binge status for 7 days. So this was, according to the directors of the study, they said that negative mood and hunger were significantly higher at pre-binge than at non-binge times, but negative mood was even higher at post-binge. Participants attributed binge episodes to mood more frequently than to hunger or abstinence violation. So basically what this is saying is that negative mood is correlated with binge. It's typically the negative moods is very common at pre-binge, but it does tend to be higher at post-binge. So after the excessive eating, and the participants also said that, emotions are linked to their binging as well, not to hunger or abstinence, which also goes back to the stereotypes on binge eating. It is not necessarily related to hunger. Okay, so what are some ways that we can stop binge eating? So the number one way is therapy. So the biggest one with this would be so from Weiser and Telk, from the Dialectical Behavior Therapy for Binge Eating Disorders from the Journal of Clinical Psychology, they said that therapy helps to change the behaviors involved and to teach coping skills. The second way would be appetite awareness training. This is from Craig Head and Allen from Appetite Awareness Training, a cognitive behavioral intervention for binge eating from the Cognitive and Behavioral Practice. So this intervention helps to monitor hunger cues and to teach problem solving, relapse prevention, and cognitive restructuring. So this is one that is based on hunger rather than emotion based, because it can also be hunger based, but it is typically more emotion. Okay, so, and then the third way would be medication. So according to Fairburn and Wilson from Binge Eating, Nature Assessment and Treatment, the use of antidepressants can help prevent emotion-based binge eating episodes. Another type of medication that also could be used would be suppression, would be diet suppression, or those would be more towards the hunger side. Um, and then the last one would be individualized treatment. Because treatment can vary from person. Sometimes one might not work, or sometimes they might need a mix of treatments to help them overcome this issue. So, what can Emporia State University do? Emporia State University, as well as these also can be used in society as well. Counseling and therapy. Emporia does have trained specialized counselors um, and therapists with training in eating disorders. Another way is by speaking up. So a biggest thing is just by slashing the stereotype. And so by doing this, you allow others to come forward and to not be ashamed of their eating disorders, knowing that they aren't alone. And then the last one is providing resources. So this could be in society as well as on a college campus. This would be by providing tips and tricks to help with eating disorders, providing hotlines and information about eating disorders as well. And then all my sources cited are listed here in the last part. Thank you. I had so much fun researching this, and it was very interesting to learn about it.